name's Brianna. I'm going to be your student nurse today. Could you please tell me your name and date of birth?
Megan Davis, 4/25/1998.
Alright, and I'll check your wristband. Okay, so today I'm going to be doing a mental health assessment on you, or a mental status assessment. So I'm going to first start by looking at your appearance, and just looking at your posture. I can see you're erect, your bodily movements are all appropriate, you're dressed appropriate for the situation, and you're well groomed and have good hygiene. So those are normal, expected findings. Next is I'm going to be looking at your behavior. So your level of consciousness is alert and oriented. Your facial expressions are appropriate for the situation. Your speech is appropriate also and well articulated. I can understand what you say, so that's an expected finding. And lastly, your mood and affect are normal. You don't have a flat facial expression or anything, so that's all expected. Next, I'm going to be looking at your cognitive functions. So I can see that you are oriented to your name and date of birth. I'm going to ask you, do you know where you are? You say at home.
At home.
Okay, do you know the month?
April.
And the year?
2020.
Alright, and why are you here?
For assessment.
Okay, so because of all that, I would say you're oriented times 4. You're oriented to the time, place, situation, and person. So that's all expected. Your attention span, you're able to focus and keep your eyes on me. Your memory is your short-term and long-term. So for short-term, you're able to tell me why you're here, so that would go along with that. For long-term, I would ask you questions about your family or anything like that that could tell me if you have intact long-term memory. For new learning, I would be asking you the 4 unrelated words test. So I would have you, I would ask you words like cat, desk, shirt, and rain. And then later I would ask you to recall those. And then lastly, for cognitive functions, I'm just going to be assessing your judgment. So I can see that your judgment is logical. You don't make any impulsive decisions or anything unexpected, so that's all good. And lastly is your thought processes. So your thought processes are logical and reasonable. There's nothing wrong with those. Your thought content, you're not constantly thinking of different things in your head and saying different sentences, so that's all expected. And then your perception, you're not experiencing any hallucinations or anything abnormal, so that is expected. And lastly is suicidal ideation. So I would ask, or have you had any suicidal thoughts recently?
No.
Alright, so that's all expected. Lastly, I would use the mini mental state examination to assess your mental state, mostly if you were an older person, so I won't be using that today. And that concludes the mental status assessment. So thank you.
Thanks.